started. What is enterovirus?
Okay, so entero means intestines. So enterovirus are viruses that typically spread through the intestines and replicate in the intestines. Now the current virus also spreads from droplets too, respiratory droplets. So typical spread of enterovirus, it's fecal oral contamination. So that means I'm changing a baby's diaper, the stool from the diaper gets onto my hands. If I don't wash my hands thoroughly, then my fingers go in my mouth, and that's how it spreads.
Wow.
And then it multiplies in the back of the throat and in the intestines, and then typically then spreads through the bloodstream. It's called the viremia, and gets to different organs in the body.
And why is there such a panic about it right now?
So, well, first of all, let's go over enteroviruses in general. So there are many enteroviruses that are kind of more commonly known. So an example, poliovirus is an enterovirus. That spreads from a viremia, it goes to the spinal cord, and it causes damage to the nerves of the spinal cord. The Coxsackie virus is also an enterovirus, and that spreads to the skin, causes lesions of the hand, foot, mouth disease that we see. So this particular virus, it spreads through the bloodstream just like the other enteroviruses, and it causes respiratory tract inflammation. For our asthmatics, that's not a good thing. So that's the worst cases we see are in the asthmatics.
And what are symptoms that parents can look for in their child if they think that they may have this?
For the asthma, it's labored breathing, so faster, difficult breathing.
Now for a child that doesn't have asthma?
Then it's a mild illness. It's not
mild
bad, yeah. So we've been seeing this probably for about 4 or 5 weeks now. I think, well, this particular virus is called Enterovirus D68. So the D stands for, I think, Debbie. So Debbie, my wife.
Your wife.
That's right.
Great.
She's the first one, I think, that got this and then spread it to the rest of the community.
Nice.
So for her, it was about a week of headache, muscle ache. This is for real, okay. She had headache and muscle aches, and she was tired. She had a low-grade fever, and it lasted for about a week. So for a week, she was miserable. And for a week, she made me miserable, too. Oh. So that's the typical course that we see for enterovirus, for this, what we're seeing, this Enterovirus D68. And it is actually called D68.
D68, okay. But not for Debbie.
No, it does stand for Debbie, yes.
It does stand. Okay, but not your wife.
No, I just made up every time.
And then, so asthmatic parents of asthmatics should, when they see the child having difficulty breathing, should be bringing them in. Now, parents of children who are not asthmatic, is there a point where you would recommend that they come in as well?
Yeah, well, it's pretty minimal illness, you know, so you're sick for about a week, you feel yucky, but then you get better.
And what are treatment options for patients who are brought in and diagnosed with it?
No treatment for it, so just supportive care. Get them to drink and treat the fever.
Great.
Take home points, just wash your hands, because that's how it spreads. It spreads from hand to mouth contact. So wash your hands. If you have labored breathing, then we should see the kids.